Welcome to today's video about early signs of poor blood flow in the brain that predict stroke. Every year, stroke affects millions worldwide. But what if your brain had been warning you all along? Medical research shows that stroke doesn't happen overnight. Long before a major stroke occurs, the brain experiences blood flow changes that produce specific, measurable warning signs. These aren't always dramatic symptoms. They're subtle signals: brief weakness, temporary speech difficulties, sudden vision changes, or unexplained dizziness that you might dismiss as stress or aging. But researchers have identified 9 specific early warning signs linked to reduced cerebral blood flow that predict higher stroke risk. Understanding these signs is about empowerment through knowledge. When you recognize these warnings early, you can seek prompt medical evaluation and potentially prevent a devastating stroke. Each sign we'll discuss is backed by peer-reviewed research published in prestigious medical journals. The research is clear. People who experience these warning signs and seek prompt evaluation have access to interventions that can dramatically reduce stroke risk. Medical advances allow doctors to assess cerebral blood flow, identify at-risk areas, and implement treatments from medications to procedures that prevent strokes. Today, we're exploring each warning sign, understanding what they mean and what medical science tells us about their connection to stroke. Let's dive into the 9 early signs your brain uses to signal compromised blood flow. All right, let's dive into the list of early signs of poor blood flow in the brain that could predict a stroke, starting with number 1. Transient weakness, numbness, or paralysis on one side. Sudden weakness, numbness, or paralysis affecting one side of your body, even if it lasts only minutes, is one of the most critical warning signs. These episodes are called transient ischemic attacks, or TIAs, commonly termed mini-strokes. Recent research reveals alarming statistics. Studies show that nearly 1 in 5 people who have a suspected TIA will experience a stroke within 90 days. Even more concerning, a substantial portion of these strokes occur within the first 48 hours after the initial TIA, emphasizing the urgent need for immediate medical attention. What happens during a TIA? Blood flow to a brain region drops temporarily due to a small clot or severely narrowed artery. The affected tissue doesn't receive adequate oxygen, causing temporary dysfunction. When this affects areas controlling movement or sensation, you experience one-sided symptoms: sudden weakness in an arm or leg, numbness affecting half your face, or difficulty with coordination on one side. Medical consensus emphasizes that TIAs are medical emergencies requiring immediate evaluation. Modern imaging can identify the cause, and prompt treatment with medications, procedures, or lifestyle modifications can dramatically reduce subsequent stroke risk. If you experience sudden one-sided weakness, numbness, or paralysis, even briefly, call emergency services immediately. Time lost is brain lost. Next, sign number 2, sudden speech problems or trouble understanding language. When blood flow to language centers drops, it manifests as slurred speech, difficulty finding words, trouble understanding others, or confusion with language. These symptoms indicate cerebral hypoperfusion in critical language processing areas, typically in the left hemisphere. Research in leading neuroscience journals examining stroke patients with aphasia found that blood flow reduction extends significantly beyond the primary damaged area. Studies demonstrate that perfusion in the left temporal lobe and inferior parietal regions, areas crucial for language, directly correlates with language abilities. Lower blood flow in these regions corresponds to more severe language dysfunction. Advanced imaging research has shown that hypoperfusion in specific brain regions can predict language recovery outcomes with high accuracy. The connection is profound. Chronic hypoperfusion in language areas can occur gradually, leading to progressive difficulties people often attribute to normal aging when they actually signal vascular compromise. Language areas require constant, adequate blood supply to function. Even temporary reductions produce noticeable symptoms. Studies document that cortical hypoperfusion in perisylvian language areas is crucial for language deficit development in stroke. If you notice sudden difficulties with speech, word-finding problems, language comprehension challenges, or slurred speech, even briefly, this signals compromised blood flow to vital language centers, requiring immediate medical evaluation. Next, sign number 3, vision disturbances. Visual processing areas are extremely sensitive to blood flow changes. Compromised circulation produces blurred vision, sudden vision loss in one eye, double vision, or visual field defects. Sudden changes signaling vascular compromise, requiring urgent attention. A prospective study of stroke patients found that approximately 52% experienced visual field loss following their stroke. Research identified that occipital, temporal, and parietal lobe strokes are directly linked to specific visual defects, including hemianopia, loss of half the visual field, quadrantanopia, loss of a quarter visual field, and other disturbances. Perhaps most concerning, research revealed that a substantial percentage of acute stroke patients experience significant vision loss, yet many remain completely unaware of their visual field defects. The brain can suffer inadequate blood flow severe enough to cause vision problems without the person initially recognizing the deficit. Visual pathways from eyes through optic nerves to the visual cortex require constant, adequate blood supply. Research demonstrates that temporary blood flow reductions to visual areas produce measurable symptoms. Studies show retinal perfusion defects closely parallel cerebral blood flow alterations during vascular events. Any sudden visual disturbances, including blurry vision, vision loss, double vision, or visual field changes, indicate compromised blood flow to visual pathways and demand immediate medical evaluation. These symptoms may represent warnings of impending stroke.
Next, sign number 4, dizziness, imbalance, or coordination problems. Sudden vertigo, balance difficulty, or unexplained clumsiness can signal more than inner ear problems. When blood flow drops in the posterior circulation, arteries supplying the brainstem and cerebellum, it produces vertigo, unsteady gait, and impaired coordination. Research found that approximately 20% of ischemic strokes occur in posterior circulation territory, where dizziness and vertigo frequently present as primary symptoms. Studies revealed that patients hospitalized with isolated vertigo face 3 times higher stroke risk compared to the general population. This elevated risk emphasizes that vertigo should not be automatically dismissed as benign. Particularly concerning research shows that patients with 3 or more cardiovascular risk factors who experience vertigo have more than 5 times higher stroke risk compared to those without risk factors. The cerebellum and brainstem control balance, coordination, and spatial orientation. When flow through their blood vessels becomes compromised, it manifests as dizziness, vertigo, or coordination problems. Research documented that in patients with vertebrobasilar insufficiency, reduced blood flow in posterior circulation, a substantial percentage experience isolated vertigo episodes, with many developing vertigo as their initial presenting symptom. Sudden dizziness, vertigo, imbalance, or coordination problems, especially with other symptoms or cardiovascular risk factors, warrant immediate medical evaluation. These symptoms indicate potentially inadequate blood flow to critical balance centers. Next, sign number 5, sudden, severe headache with no clear cause. A sudden, severe headache, unlike anything you've previously experienced, often described as the worst headache of your life or thunderclap headache, can signal serious vascular problems.
While more commonly associated with hemorrhagic strokes, sudden severe headaches reflect vascular issues that significantly increase stroke risk. Research found that headache frequency in stroke patients varies widely, occurring more commonly in hemorrhagic strokes, including subarachnoid hemorrhage, than in ischemic strokes. The American Heart Association emphasizes that a sudden severe headache represents a hallmark sign of subarachnoid hemorrhage, bleeding in the space surrounding the brain. Statistics show that approximately 10 to 25% of people with thunderclap headache have subarachnoid hemorrhage. When a cerebral aneurysm ruptures, mortality is devastating. Studies show about 1/4 of people don't survive the first 24 hours. Research documented that acute onset headache, often accompanied by vomiting and severe blood pressure elevation, are prevalent warning signs leading to rapid neurological deterioration within minutes. Studies consistently demonstrate that hemorrhagic stroke patients have significantly higher rates of acute severe headache compared to ischemic stroke patients. A sudden thunderclap headache, particularly with neck stiffness, confusion, vision changes, or loss of consciousness, demands immediate emergency evaluation. This headache type can signal vascular catastrophe, including aneurysm rupture, requiring urgent life-saving intervention.
Next, sign 6, cognitive decline or confusion. Progressive cognitive decline, memory problems, confusion, or difficulty with thinking can result from chronic cerebral hypoperfusion, sustained reduced blood flow. While cognitive decline has multiple causes, vascular factors contribute significantly, making this an important warning sign. Research established strong connections between reduced cerebral blood flow and cognitive impairment. Studies show chronic hypoperfusion damages brain tissue gradually, contributing to vascular dementia, the second most common dementia form after Alzheimer's disease. The relationship works both ways. Reduced blood flow damages neurons, and damaged brain tissue can't effectively regulate its blood supply. Large population studies found that people with vascular risk factors, including hypertension, diabetes, and high cholesterol, face significantly elevated dementia risk, largely mediated through effects on cerebral blood flow. Research demonstrates that lower cerebral perfusion independently associates with increased dementia risk, with hypoperfusion often preceding visible neurodegeneration. Specific patterns suggest vascular causes. Vascular cognitive impairment often affects executive functions, planning, organization, problem-solving, more prominently than memory. Progression may be stepwise rather than gradual, with sudden deteriorations corresponding to small strokes. Subclinical strokes accumulate over time, gradually impairing cognitive function while increasing future stroke risk. If you or loved ones notice progressive cognitive decline, memory problems, or confusion, especially with cardiovascular risk factors, comprehensive evaluation can identify treatable causes.
Next, sign number 7, impaired cerebral autoregulation. Cerebral autoregulation represents the brain's ability to maintain stable blood flow despite blood pressure changes. This protective mechanism ensures consistent oxygen and nutrient delivery. When autoregulation becomes impaired, the brain loses this critical protection, significantly elevating stroke risk. Advanced monitoring can now assess autoregulation function, revealing impairment before stroke occurs. Research examined patients with severe strokes and found those developing massive brain swelling had significantly greater autoregulation impairment compared to those with better outcomes. This impairment was detectable within 24 hours of stroke onset. Studies found that dynamic cerebral autoregulation becomes impaired even after minor strokes, with bilateral impairment particularly after small, deep brain strokes. This impairment shows progressive deterioration in days following stroke and directly relates to neurological worsening, need for surgical decompression, and poor outcomes. Research in patients with chronic kidney disease and acute stroke found that lower kidney function correlated with less effective autoregulation.
Both factors independently predicted worse outcomes and increased risk of hemorrhagic transformation, dangerous bleeding into stroke-affected tissue. Specialized testing revealing impaired cerebral autoregulation indicates your brain lost critical protective mechanisms against blood flow fluctuations. This finding significantly elevates stroke risk and warrants intensive medical management, including careful blood pressure control and treatment of underlying conditions.
Next, sign 8, low regional cerebral blood flow on imaging. Advanced brain imaging can reveal regions where blood flow has dropped dangerously low, often without producing obvious symptoms. Research established specific thresholds where low cerebral blood flow predicts brain tissue damage and stroke progression, allowing doctors to identify at-risk areas before permanent injury occurs. Studies identified critical cerebral blood flow thresholds in acute stroke settings. Brain tissue with blood flow at or below approximately 12 milliliters per 100 grams per minute faces high risk of infarction and stroke expansion. This threshold represents insufficient oxygen and glucose delivery for normal cellular function. Research examining chronic stroke patients with language impairments found regions with persistently lower perfusion had worse functional outcomes. Hypoperfused tissue couldn't fully support recovery, leading to more severe residual deficits. Comprehensive research using specialized MRI found that lower cerebral perfusion independently associated with increased dementia risk during extended follow-up. These findings suggest cerebral hyperperfusion precedes neurodegeneration, potentially offering opportunities for preventative intervention. Low regional cerebral blood flow is particularly concerning because it exists without obvious symptoms initially. Brain tissue survives, but operates under stress in a vulnerable state where additional challenges could trigger stroke. Advanced imaging, including perfusion MRI or CT, can detect these at-risk regions, allowing preventative interventions.
Next, sign number 9, reduced cerebrovascular reactivity or reserve. Cerebrovascular reactivity refers to brain blood vessels' capacity to dilate when needed, their ability to increase blood flow on demand. This reserve capacity allows the brain to meet increased metabolic needs. When this reserve becomes exhausted, stroke risk increases substantially, particularly with large vessel narrowing. A comprehensive meta-analysis published in Stroke examined cerebrovascular reserve in patients with carotid artery stenosis or occlusion. Impaired reserve was significantly associated with increased stroke risk, with some studies showing patients with severely impaired reactivity facing more than 6 times higher stroke risk compared to those with preserved reactivity. Another large meta-analysis of individual patient data from 754 patients with severe carotid stenosis or occlusion found that impaired cerebrovascular reactivity, measured by specialized ultrasound, was independently associated with nearly 4 times higher risk of stroke on the same side as the narrowed artery. Research following patients with carotid disease found that severely impaired cerebrovascular reactivity predicted stroke and TIA risk. Patients with exhausted reserve had significantly elevated stroke rates. Reduced cerebrovascular reserve means brain vessels can no longer recruit additional blood flow when needed. This leaves the brain vulnerable to minor blood pressure fluctuations or increased metabolic demands, substantially elevating stroke risk. We've explored 9 powerful warning signs, signals your brain uses to communicate that blood flow is compromised and stroke risk is elevated. From transient weakness and speech difficulties to vision disturbances and dizziness, from sudden severe headaches and cognitive decline, to impaired autoregulation, low regional blood flow, and reduced cerebrovascular reserve. Each sign is backed by rigorous scientific research. Understanding these signs is about empowerment through knowledge and early action.
Your brain signals when something isn't right, but these signals are often subtle and easily dismissed. The research is unequivocal. People experiencing these warnings who seek prompt medical evaluation have access to interventions that can prevent devastating strokes. If you notice any of these signs, especially repeatedly, or if you have cardiovascular risk factors, including hypertension, diabetes, high cholesterol, smoking, or family history, don't wait. Seek medical evaluation promptly. Modern medicine offers sophisticated tools to assess cerebral blood flow, including advanced imaging and specialized testing. Treatments range from lifestyle modifications and medications to surgical procedures that can dramatically reduce stroke risk. Remember that stroke prevention is far more effective than stroke treatment. By recognizing these 9 early warning signs and acting promptly, you can potentially prevent a stroke. If this video was informative, please like, share with family and friends, and subscribe for more evidence-based health content. Thank you for watching, and remember, your brain is always communicating. Learn to listen.